Hi everyone, this is Saskia from Los Angeles Guinea Pig Rescue, and today we're going to do another walkthrough. We haven't done one, I think, for a couple of months, which is silly because we have so much interesting guinea pigs with interesting cases that I want to share with everyone. And it's August, and middle of August actually. We have a big list of pigs that we have right now that we're caring for, that have all kinds of stuff that we recently got from the shelter or were surrendered. And it just also gives you a good idea of what we're dealing with on a day-to-day basis here, because there's always a big list of special needs pigs. So this here is Stella. Let's start with Stella. Stella came in a couple of weeks ago. She's a very old lady. I reckon she's about 5 or 6. And she was just covered in ringworm everywhere in her little face. And you can still see how it's still growing back, but the crusties are no longer there. This was all nasty crust. So I know you don't like it so much. I know. She was seizuring also when you pick her up, and it wasn't good. So now she's doing a lot better, and she is very active. Come back, little one. Come back. And you want to see her from behind as well. Come here, sweetie. Come here. You can also tell her that she's an old lady by looking at that. And she's kind of splay-legged too. You silly girl. Okay. So, very sweet little thing. And she also has this hair loss here, which could possibly be from the ringworm, but I think it's from ovarian cysts. As you can see, she's got a quite big sides. You'll probably be able to see it here as well. Quite big sides, and that is caused usually by ovarian cysts. So what we're doing for her, we actually are using, the vet gave us an intramuscular injection to give her. Once, and then repeat it in 2 weeks, and then in a month, and then when showing signs. So, this is called cistrulline. You want to look at this? Because I don't know how to pronounce it.
I believe it's cistrulline.
Cistrulline. There you go. And you know what? It is amazing because we just did it when? When did she get the injection? Not that long ago.
Her first injection was about a week ago.
A week ago. And you know what? This used to be bigger and more bulgy and really hard, like almost like there's tumors in here or something. I mean, I can still feel like real hard stuff, but you know what, it's gone down a lot already, and it's soft. It's now soft. I can actually, you know, it's a little squishy now, whereas before it totally wasn't. So that stuff works. So if you have a guinea pig, a girl that's suffering from that, go and ask your vet for that medication, because it really works. Okay. All right. Oh, she also had, she was a mess. She also had a big stone. In fact, I have the stone. Why don't you pause for a second? I'll go get it.
Let's go get it.
So this is the stone, and it was actually one piece. So what the vet does, just a local anesthetic, and then kind of breaks it up inside the urethra. It's just crazy, right? Or the entrance to the urethra. So, and you can see it right here. It's this big bulge. So that's why I'm always checking when I get females, especially when they're a little older. I always feel right here to see if they have some stones there, because they can get stuck. Now what's interesting is that she didn't seem to be bothered much by it, because she wasn't not wet at the bottom when peeing or in pain or squealing or anything. I've seen that before, where they just don't really seem that bothered even when they have a big stone. But obviously I cannot be comfortable, so we get it out, and it's a pretty easy procedure. No, eat that, not the plastic bag. Good girl. So this is little Stella, and you know, she's a really old girl. She'll probably stay with us in sanctuary. She's just, you know, I don't know if you need another home. You can just live here and be happy. Okay, and then let's see, Clara.
Let's wait for Clara.
Okay, Clara. Hi, sweetie. This is a young girl from, I think, the North Central shelter, and she came with ringworm around her eye, and this has only been about a week or so, but she's made tremendous improvement. You can't even see it anymore. It's amazing. And what we do, we just do a bath. It's super easy with over-the-counter stuff to treat that. We do a bath, and then we apply the athlete's foot cream directly onto the spots, and that works miracles. So So there, you're pretty much all better. Yeah. Okay, this is Adriano. He came with a chronic wound, and we tried to get it better, and it just weepy like this. We actually did a culture to see which antibiotic is gonna work best for him, because it's not good and it's not really going away. So the vet said, let's do a culture, and then we'll see if we can specifically find the right antibiotic that's gonna work for him. And you know what? He's like interesting. I mean, he's really active. He seems fine. He's eating good, yet he's starting to lose weight, which obviously is because of the infection. So we gotta clean this all the time. And what happens actually when he moves, or you pick him up and you kind of move a certain way, like a whole bunch of stuff comes gushing out. So that tells me that it's a really deep abscess, likely puncture of some sort, or you know, that is super deep, maybe even like behind the muscles or something. Must be a big pocket of pus. So not good. But we're gonna fix you. We're gonna fix you. And he hates it when I, oh, you're being so good now. No, not really. You don't like it much. Stinky stuff. You can see right here. And then when he moves, it just literally just comes gushing. Hey, baby. Let's see. Come here. Hey, you want a snack? See? There it comes again. Oh, yummies. Just from walking around a little bit, he just got this piece coming out. And it's funny because when I press it, nothing really comes out, but it's when he starts to walk. So, okay, we're gonna flush this again in a little bit. And then on to the next pig. Grayson. He was surrendered. It was an unexpected surrender. A gentleman just walked up with him in his arms, and he had this massive lump under his neck. And this is about a couple of weeks ago. So the massive lump is no more. We drained it and flushed it, and there he is. He's all good now. You see, it's still a little bit swollen, but that will go down. That's not unusual, but it's looking beautiful. It really is doing really good. And he was just such low spirits when he came. I remember, like, man, he doesn't look good. Remember, Ursula? Mm-hmm. Yeah, he was not looking good at all. So it's amazing how he's better and so thriving, and his coat is all shiny, and his eyes are like, you know, bright. It's just fantastic. You're doing very good. So you're almost ready for a home.
Yeah, he'll be ready for adoption soon.
Yeah, maybe this weekend actually.
Awesome. Let's see who's next.
See who's next. This is Petunia. Petunia came from a shelter, and she was actually Pippi's little friend. And what happened is that she got really sick about 5-6 days ago. And you can see she's still not really 100%. You can just kind of tell how her fur is all kind of like, you know, it's just not, I know, not a healthy pig, and you can kind of tell. Not very happy. She stopped eating totally. She had bad diarrhea. It was not good. So we started syringe feeding her. We gave her subcutaneous fluids. What else did we do for you? She's on antibiotics right now, and
she's on pregnancy watch.
She's on pregnancy watch because she was in with a male at the shelter. So yeah, teenage pregnancy. But I'm so happy to see her like this, because I honestly for a moment there thought she's not going to make it, and I think she's kind of over the worst of it, and she's probably going to be just fine because she's actually eating. The diarrhea she had was just horrible. When piggies get diarrhea, it's terrible because they really dehydrate. So what I use is charcoal, activated charcoal, and I just put a little bit of the powder and with a little water, and then we give it to them orally, and that really helps with the diarrhea. It kind of absorbs toxins and then expels them. So that's good stuff. So you're doing great.
On a side note on the diarrhea in guinea pigs, a lot of people say to feed them less veggies when they have diarrhea. What is your take on that?
Yeah, less veggies when they have diarrhea. No, I don't think that it's caused by too much veggies. But then again, listen, I've seen people feed this whole thing to one guinea pig twice a day, and then yeah, then I wouldn't be so surprised if they have soft poopies, because that's a lot of greens, right? And if they're eating so much of this, they love it so much, they're probably not going to eat the hay and the pellets and the other stuff that they need as well. So yeah, I can kind of see how there's not enough roughage, how they can get like soft poop. But I do not believe that veggies cause, or like if you're feeding a normal vegetable diet, that's the cause of diarrhea. And the other thing, look at you. Oh my God, I'm just so happy to see her eat. And the other thing, if your guinea pig has diarrhea, I would not necessarily cut down the veggies, because there's actually a lot of liquid in the veggies. So if they have diarrhea, they kind of need those liquids, right? And they get a lot of it from the veggies. So we don't do that. We don't cut down the veggies, because I don't think that's a good idea. So.
All right. Awesome. Next pig.
Pablo. I can teach you tricks. Yeah, you're one of those pigs I can teach tricks. Go sit down. No, you're gonna stay here. You can't run away with it. You're gonna stay here. So some of you might remember Pablo. He has hyperthyroidism, and we got him on medication, which is a beautiful thing. We just started him, and we're gonna wait and see in about a month and reevaluate. So hyperthyroidism makes them skinny. They have polydipsia, which means lots of drinking water. And his cage is always soaked, because it always drools. He always drools in the water when he's drinking it. He's a mess. You're a mess, buddy. And we love him. And he's always hungry, always eating. We always feed him extra, and he just keeps losing weight. And he's a little hyper as well. That's another sign of the hyperthyroidism, is that they get a little hyper. And yeah, he's a little nippy. So we got to be careful, but actually when you hold him, he just loves it. He just kind of melts into you. So he really enjoys the affection. Yeah, you're just a funny little guy, a little socially awkward. But we'll do another update in a month and see how he's doing. Next pig. Oh,
Next
I want to show the medicine. Oh, look at that, dude. Pablo. That was not a tomato. Actually, good thing he didn't bite me hard. He was just like holding my thumb. What do you want? He's so funny and very specific what he wants. Like, he's like, no, I don't want that right now. Oh, really?
He likes tomato.
Wow. So yeah, look at him. He's like ravished, but trust me, he eats all the time. This is his medication.
Methimazole.
Yeah, he just gets a little bit every day, and we're going to reevaluate him in a month and see if anything, if he's starting to gain the weight, if he calms down a little bit. We'll see. Hopefully it will work.
Don't take that tomato.
The alternative's not good.
Don't take that tomato from him.
No, I know. I wouldn't dare.
Oh, Pablo.
I love him. He's been with us for a bit. I love him.
Next pig.
Here's Coco. Coco had a broken leg, and really badly broken leg. The x-ray's crazy. So what happened is that the vet did a splint, and this is her third splint change. It's been about a month, I think, now. And she's due for another change, or hopefully, I mean, I'm not sure when it can come off, but hopefully soon. And she's the loudest little thing here when it's dinner time. My gosh, you will not miss out on feeding her. And she is so fast on that little cast. It's unbelievable. And she also has developed a little bit of ringworm here on the ear, as you can see. And ringworm is so incredibly common in guinea pigs. It really is super common. Vets will always do a scraping. So if you have a guinea pig with a skin issue, you go to the vet and they will always do a skin scraping. And those skin scrapings often come back negative. I'd say 60% of the time they come back negative. So the animal doesn't actually get the treatment it needs. So I always say, you know what, just treat for both. Treat for mites and treat for lice at the same time. So, and they can just get it out of nowhere. I mean, she's by herself, has been for a month, and here you go. They carry the spores with them. So that's why I also recommend doing the shampoo as a preventative as well, because as you can see, it just comes boom out of nowhere. Good girl, Coco. And she's grown. When we started the process, she was like half this size. So she's doing good.
All right, let's look at our next pig.
All right, Darcy. Do you remember Darcy? He's the one who had this horrible broken leg as well. But with him, unfortunately, his whole leg needed to be taken off. And here he is. He's completely not bothered by it. It's a beautiful procedure. Everything went fine. And he can run around like you wouldn't believe. You're our expensive guinea pig. Yeah, because that was a lot of money. And you know what? Our community is so beautiful. Everyone just came together and pitched a little money here and there when we managed to pay for the surgery. It's just so heartwarming. Hey, Darcy. Want to show us how well you can walk? No, you're a little scared, huh? He's a little skittish still. Hey, sweetie. So funny. Often when guinea pigs are really scared, really scared, they won't eat when you're, you know, in a situation like this. They just don't want to eat. They're so freaked out. But he's doing great. I'm so happy. Yeah. Feels so good. Still on some antibiotics, but he should be done with that soon. And he's going to be just a totally normal guinea pig.
All right. Yay, Darcy. On to the next one.
This is Paisley. And Paisley had a very bad bone infection. She came and her little paw was like this size. It wasn't a bumblefoot. It was just like a bone. It wasn't like just as simple as a bumblefoot. It was just a lot more going on. So let me see what it looks like now. It's actually just so beautiful. It really has gone down. Wow, I'd say it's gone down by 80% almost. It was really swollen and scabbed, and look at it now. So what we did for her, in the beginning we soaked it, Epsom salt and betadine soak, warm water, not hot, and Bactrim antibiotics is what worked for her. But she's been on the antibiotics for some time now. It's been probably at least almost 2 months. Yeah, but that's what the vet said. Just you gotta give it, because otherwise she's not gonna get better. So you gotta keep giving that antibiotic. And of course she gets Benebac as well, because the antibiotics are not that good for their gut.
She's an older lady.
And she's an older lady, which makes the healing process not easy.
But she's very sweet.
She's very sweet. So that is amazing considering what it was. And again, the x-ray was horrible. I mean, you could just see that infection in the bone in the foot. But she's all good.
Yay, Paisley. Let's look at our next pig.
Oh. Okay, remember Penelope? Penelope! Hi! Hi, honey! And what she always does, she always kind of squints a little bit when you just pick her up. I don't know why, it's really weird. You kind of squinting with that eye too. It's almost like the sun or something. She's very sensitive. But remember, she's the one who had this massive hay poke that I took out for her. And she's just looking beautiful. No damage. You can see in the eye, didn't go blind. I mean, she just looks great. Why aren't you eating? A little freaked out? She's so sweet.
She's a very sweet pig.
Such a gentle little soul, this girl. You just love, oh yes, is that good? Just love it when they close their little eyes and just, oh yes, it's so good. Good girl. And you know, I don't know why she's still here. Why she hasn't been adopted. We have a bunch of skinnies actually, and no one's really interested in adopting them, and it's just, I don't know why. I thought they were all the rage. Anyway, I love you. I do. You're a good girl.
Sweet Penelope. Alright, let's see who's next.
And this is Lizzie. Lizzie's very pregnant. Very pregnant. Okay, mommy, hold on. You can see, and she's very small, young girl, and more than half her size is the babies in here, and I can feel the babies. It's just beautiful. I can feel like a little head here and a little leg. I mean, it's just if she stays still, and you can just feel the baby's kick as well. She's due any day now because they're all so fully formed. I can just feel that they're like waiting to get out. So any day, and she's what, all of 4 months? I mean, she probably got pregnant when she was like maybe 8 weeks or 7 weeks old. Poor thing. And she came with her mama, and her mama had also 2 babies.
And her mom was also on pregnancy watch.
She's again pregnant, probably, yeah. So this came from the shelter, I believe. Yeah. Oh, yummy. More, you need to eat lots.
Oh, she eats everything.
You need to eat lots. Good girl.
Let's watch her eat for a minute. Eating for possibly
Ooh, let's see.
4?
Yeah, I think there might be 4 in here. Maybe even 5, actually.
Eating for 5.
I say 5. We'll see. You say 4? We'll see.
I say 4.
And while she's eating, I'd like to introduce Steph, who's our new team member. Because Allison, she left to go to Alaska to be RVT, registered veterinary technician. And so Steph has stepped in her shoes. And we're teaching her everything we know about guinea pigs, and she's been awesome. And you still, I will always say every day, hey, look, she's still here. She hasn't run away yet. Because I tell you, this is hard work. This is not like, oh, I'm going to pet guinea pigs all day. Oh, wow, this is super hard work. Okay.
All right, next.
And here is Fire. You might all remember her. She's still here. And we had her on some antibiotics, and it just didn't really work because I'm still able to pull out a really large plug out of her nose. There's a video actually, where her intake video, where I do just that, and this big thing came out because she's got this hole in her nose here. That might have been like a dog bite or something, and she came from the shelter. Where is it? Oh, it's right here. Yeah, I can feel that I can actually pull something out of here. Maybe I should try and do that because it's, yeah, let's go and do that.
Let's get the tool.
Mine broke, so I got a new one. I'm so happy with this one because it has a light as well. Okay, I know. You're a little bit, a bit of a drama pig, this one. I know, I'm not hurting her. It's just this little crust that I can either hook it and it'll come out. All right. Good girl. Good girl. Oh, she's complaining. Do you hear her talk? You can hear? Here. There's my mic. Go on, talk. I should do a video on sounds and what the guinea pigs are saying. But she's like, man, leave me alone. I'm eating. Go away from me, lady. I don't like you. I wouldn't like me either. Just fussing. Good girl. A lot of patience. It's right here. No, it feels weird, Mama. I know. Do you want to eat? Why don't you eat, and then we'll have a trade, okay? Can you see it actually in here? Can I have a look?
Yeah, I can see Coco just a little bit.
See that big crust?
Yeah.
Yeah, so that's what we want to get out. And then she starts to sneeze because it just, that hole obviously connects with like the nasal passage. So the minute I start doing anything there, she starts to sneeze, and you can hear it's all congested because that's like, you know, could actually be a bit of an active abscess or infection in there. And we've done a culture on her as well to figure out exactly what we're dealing with, so we can really, you know, be more precise with the treatment rather than waste time with different types of antibiotics. Okay, I know, just feels so weird. Because honestly, guys, this is just like a big booger. It doesn't hurt her. It's just a really weird feeling, I know. And, you know, before she was actually good, but I think now she figures that, yeah, I know what you're gonna do. I know. She's good. They're so good like that. Unbelievable. It just amazes me every time. When they want out, they're gonna get out. Doesn't matter how well you wrap them up. And these little pawsies, they'll come out they'll find a way to get those little feet out. And it always makes me laugh. Like, wow, you're really good. And I don't ever lose patience, because you're done if you do that. You can't do that. So you have to be super patient and just big smile on your face and try it again. Okay, honey. Because I'm not a big fan of really holding your guinea pig down and forcing them, because you know what? They struggle harder if you do that. So I just like to have them calm down themselves and just try it a few times. You know, it might take a little longer, but not stressed out.
Oh, I see it. It's right there.
Yeah, it's right here. Yeah.
It's a big piece.
It's a big piece. Okay, this is it. We're gonna get it now. Oh, honey, it's right here. I can see it. It's so good. I can see it right here. It's already loose. She just pulls away every time. Oh. Here, look. Have a quick look inside. See how it's loosened up. You see it? Good girl. That's about it. Yeah.
That's all mucus, right?
Yeah, she's nibbling my finger. I know. I honestly, you're allowed.
Oh my goodness.
Hi, sweetheart. You feel a little better? Does it feel better?
Out of that. All it is hardened mucus, right?
Yeah. And you know, there could be, there's definitely an infection. If you look, you know, there's definitely an infection going on. All right, Mommy. So, culture, we're going to figure it out, and she's going to be much better then.
All right, Fire. We'll come back to you.
Where's Miss Moo? Missy Moo. Missy Moo. Sweetheart little thing. Now, what's wrong with her is that she has that head tilt. She is blind. Here. Or, you know, vets always diagnose this as an ear infection, but I'm just not convinced it is. I really am not. Now, what's interesting is that what I've come to compare those cases that come in is that they often have an eye that's kind of weird. It's really weird how they all have that. And you know what? There's another thing which is really interesting. So they all tilt their head to one side. Often the teeth will start to grow incorrectly, the molars, because one side goes faster than the other, which kind of makes sense. Now, what the other thing I've noticed is that it's almost like a stroke. So you can, if you stop eating for me for 1 minute, Mommy, then you'll see that her lips are not quite straight. You see how that one corner is kind of off? Do you see it? Yeah. Now that is crazy, right? They all have it. Now, not only that, but then there's the blink reflex that's kind of missing as well. So let's see. See? No blinking. Let me try the other eye. Unless she's doing it with this eye as well. Come here, Mama. It's okay, Moo. It's okay, Moo. It's okay. It's okay. Oh no, she's doing it with this eye as well.
She blinked on the other side.
Yeah, she did blink on the other side. Yeah. Yeah, she is blinking. So you got to really keep an eye on that so that it doesn't dry because she's not blinking enough. And it's like a facial paralysis. And I see it again and again and again in these pigs. I have another one I want to show you. He's exactly the same thing. And her eyes, you can see her eye is okay, but I can kind of tell that something's still not 100% in this eye. I mean, something is just not quite right. And I know it's gonna just start getting worse from here. Like from up here, I can really see it. I see this big spot in there, this gray kind of looking thing. So ear infection, wow, I just, I'm not buying it. I really am not, because I see so many of them and they all show with these symptoms. Maybe it's something that they can come later as well if it's more advanced. And another thing is that this tends to happen from one day to the next. Guinea pig is fine, doing great, eating fine, goes to, stop it you guys, goes to bed. Owner wakes up in the morning and all of a sudden the guinea pig is completely off balance, and it's like sometimes in the beginning when they really are getting used to their new condition and such, they'll be like making circles and they're kind of bobbing their head, and just like Stevie Wonder does, kind of like that. That's because I think because they're blind and it's vertigo. So, and they will fall over as well. A couple of weeks down the line, they usually are over that and they can actually just, walk without falling over. You like this one? Of course you do. All guinea pigs love this one. I love this.
The natural
this
cavity.
Is the natural cavity. You say cavity?
Cavity?
Natural cavity. And this is one of the super treats that guinea pigs, all guinea pigs love this stuff. And it's not so easy to find here, but the natural cavity has it. And it says something about you can only feed like a little bit of this. And I just think you can feed a little more than that. It's like, oh, you feed about that a day. You can feed at least that or a little more even over a course of a day. Because you know what? There's nothing more fun than just to walk by your cage and give them a little snack, right? I mean, that's what I do all day long. It's very distracting, actually. Okay, Missy. Now let's get your little friend who has the same thing as you do. Yeah. Petunia is exactly the same thing. So look, have a look at his mouth, and you'll see how his lips also kind of go onto the side.
You can't see it right now, actually.
Really? I could see it just now. Here, come here, baby. Yeah, you can totally see how his lips kind of, it droops on this side. He's got a very cute nose. Yeah, you do. Look at his eye. Same thing, this eye, what I mentioned. They all have it. And let me see about you blinking. Can you blink with this eye? No blinking. And what about here? Yeah, he blinked on this eye, and he's not blinking on the other. So, crazy, right? So really, the question is, what causes the blindness? I think if we figure that out, we are, it's just a symptom of it. It's not actually the cause. So what causes it? I mean, we just don't know. Nobody knows, and it's always guesswork. And then I've seen vets take X-rays where it's still inconclusive, because oftentimes, and this is really crazy, it's both bulla. I've seen the X-rays that look like they're filled with crust, right? An ear infection would kind of show up like that, just some matter kind of stuck in the inner ear, but it's both. So whenever I've seen a pig like this, and I've seen an X-ray of that pig, of its head. It's always both. There's a little bit or nothing. You know, it's just really weird. So if it's an ear infection, you think, oh, it's just one ear that is affected. Nobody knows, man, and that's my life's work. I want to figure it out. Really, it's just because it's so super common, and I think everyone kind of settles with the ear infection, but antibiotics don't work. That's the other thing. You can put antibiotics, you can give them any antibiotic at all, different kinds, and it does nothing works. So once they're like this, it is highly unlikely they're gonna come back. So is it maybe a brain parasite or I don't know. Don't know, but I'd really like to find out. It's so common, and I don't know. You know what? Is this common in Europe? That's actually an interesting question, because this is the United States. Pretty common here. If you're watching and you're from Europe or UK or wherever, then let me know. Is this something you guys see over there? Is this a common thing or not? I'd like to know that. Okay.
Cutie. All right.
Oh, the other thing is that they're very skinny. That's the other thing I forgot to mention. Miss Moo too, super skinny. I can feel his little bony butt. And he's not that old actually, this guy. And neither is Miss Moo, a young pig, but they're so skinny and you can't put the weight on. That's the other thing. So weird, but they're eating, but often they're not, you know, they're eating, but it's just, something's just not right. They're not quite putting the weight on. And then sometimes they just start to eat less and less and less. Sometimes they become severe special needs actually, where they just keep going downhill, 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 and then you got to syringe feed them, and it's a constant struggle to keep them, you know, keep the weight on.
Okay. Well, I think we have somebody special coming up next, right?
Yeah.
Let's see.
It's my little Pippi. Pippi! Hi, little Pippi. Hi, little girl. Hi. So when we did that video on Pippi, she was 75 grams. She weighed 112 today, which is how long after the video? It's about 8 days or so. So it's not a lot of weight gain, but man, it's weight gain, which is great because it wasn't looking good for her when she came in. She was just so weak and so skinny and so fragile, and now she's like, and she still has a great appetite. Let us see you eat, Missy. And she loves romaine. Loves it. She was popcorning in our cage the other day. It was the cutest thing. Very happy little pip. Weaking because she didn't get her romaine. That's what she wants. She'll start yelling at you because she wants romaine. Not the other stuff, she just wants romaine.
She's a lot smaller than your average 3-week-old, right?
Yeah, you know what? Let's get our little friend out so we can compare what they look like now.
Let's
Little
see.
white baby. Yeah. Oh, baby. This is your little friend. This is Winnie. This is little Winnie. Pippi, Winnie, hi. Week old. 3.5 weeks old. Pippi is 3.5 weeks old now. And this little baby weighs more than Pippi. Oh, what are you doing? What are you guys doing? That's your friend.
Trying to take my lettuce.
She's a feisty little thing. You're a feisty little thing. Here, you want to eat something too, Winnie? Here, why don't you go and snack? Everybody go snack. Pippi, you gotta share. Be a good girl. Earlier I gave her a piece of carrot. It was about this big, much bigger than her. And she grabbed it in the middle and ran off with it. It was the cutest thing. So I have to try and see if I can get some footage of that. But Pippi, you're famous. Everybody loves Pippi. Let's get the other baby too. Let's see the other baby. We've got more babies.
There's plenty plenty of romaine.
Thank you. This is Winnie's little brother. Ooh, it's okay. It's okay. Here. Hey, baby, turn around, Mama. It's okay, little man. He's like shell-shocked. Like, what? Your sister's here. Your little sister's here. It's okay. He's not having any. And look at Winnie's color. This is not all white. She's got this kind of lilac, light brown here. And from a distance, looks like she's dirty, but she's not. There you go. And a Pippi eat. Everybody eat. Ooh, no pig. Yeah, nothing better than guinea pig babies. Guinea pig babies eating.
Pippi's definitely the star here.
Yeah. I think she's gonna have a little fuzzy hair, a little longer hair. Because look how fuzzy and long it already is. I'm pretty sure. And she's a little, she does nips a little bit. It's not bite, but she just kind of scrapes her teeth on your finger. That's a bad habit. Bad habit, Mama. All right, so that was it, our August walkthrough. And I thought I'd just end it with little Pippi and friends. I hope you enjoy it.
Oh my goodness. Thanks, Seth. See you guys next time.